Our summer bundle was supposed to end, but after hearing from so many moms who said, I meant to sign up, I've decided to extend it for a few more days. So you can still join My Essential Birth for just $197 and receive all 3 bonuses: the Birth Partner Quick Reference Guide, Belly Mapping Guide, and Empowering Birth Meditation Chat. If you're ready to feel more confident, prepared, and empowered for birth, now is the time. But don't wait. This extended offer ends June 24th. Visit myessentialbirth.com/get started, all one word, and join today.
You do want parents to ask for people who have had training in ties, because it's a lot of assessment. You have to be able to understand, how the body is supposed to be looking and working and feeling in order to determine, like, is this a functional restriction or not? Is this going to impact? There's going to be babies who have mild symptomatology. When we start talking about, babies, and moderately or significantly impacted, we just know that there's more symptomatology. So the baby between mildly impacted and significantly impacted is just symptomatology, because some babies have a lot of GI issues, a lot of reflux, gastric emptying, fussiness, distended abdomen, decreased bowel movements. There's all kinds of things that show up with this. And babies, that is so uncomfortable for them that they're also then crying. And that causes a lot of, we're trying to solve a lot of problems, and releasing the tie doesn't solve them. It's a part of it, though.
Getting pregnant and giving birth are 2 of the most exciting things you can ever hope to experience in this life. The moment you think you could be pregnant, you're frantically searching for all the best information, which is why you're here today. I'm Stephanie King, and with my many years of experience as a professional childbirth educator, doula, and lover of all things pregnancy, birth, and postpartum, I'm here to make preparing for your birth enjoyable, empowering, and totally easy. Each week, I'll cover different topics, interview professionals, and get into the nitty-gritty birth stories from mamas just like you. And when you're ready for more, you can join me in the My Essential Birth course at myessentialbirth.com, where I take you step by step through exactly how to prepare your mind, body, spirit, and partner for a birth you love. So let's get started. All right, today I have with me Michelle Emanuel, and she is a pediatric occupational therapist, a board-certified reflexologist, and international board-certified lactation consultant who specializes in helping babies with tongue ties, feeding challenges, and oral function thrive. So with that, Michelle, thank you for being here. Take a moment, tell us a little about you, kind of how you got started, and then we'll dive into all the questions I have.
Okay, awesome. Thank you for having me. I'm grateful to be here. And this is a really important topic. And how I came on it was with my own kids, actually. So my second baby and her latch and everything that we went through with her. And things were much different then, because she's almost 24 now. And services weren't there, and just was not a good, well-supported environment for that. But I started learning professionally. And I was at the time working at Cincinnati Children's Hospital Medical Center, and I was working in the NICU. And so we would see a lot of oral dysfunction, and it popped up there a couple of times. And then I just started learning more and more, and got connected to the tongue tie field through Allison Hazelbaker, who is a lactation consultant, and who really rallied the troops, so to speak, which getting a group of professionals together. And so we started having conferences many years ago and learning more about what ties were impacted, what we were seeing from a multidisciplinary perspective. And so I was really lucky to be, involved in early on conversations about tongue tie. And now it's a lot, there's a lot more resources for it, and a lot more people have access to information. But it's kind of come along over the years, over even the last 20 years, and then especially over the last 5 years. And I'm an occupational therapist, and I do a lot of lactation-based things, but my core is really helping and seeing babies. So I've been watching and closely observing and documenting and analyzing the movements and the behaviors of babies that have oral dysfunction and restrictions. And it's been a really fun thing to learn how complex this is. It seems simple, but how complex it is, because we're humans and we get affected by ties in different ways based on our system, our unique genetics, and our caregiving, etc.
Yeah, I'm glad you're doing the work. And it's like you said, same thing. Even when I was having my babies, I don't know that it was a super big thing that we were talking about. I didn't hear about it until after I started teaching birth classes and went to some IBCLC meetings and women were talking about it. And I don't think any of my babies had it, which might be the reason that, I wasn't aware of it being a situation. But now I feel like it's everywhere. And I'm glad you're here because I feel like there's also, with like the boom of information, there's a lot of misinformation or
Right.
parents who are misguided and confused. And so that is what I hope to kind of be able to set some clarity and some really good information with today. And so kind of starting off from there, will you just explain what is a tongue tie for moms who may have never heard it or even for those who have?
Okay. A tongue tie is an embryologic malformation. It's happening early on in embryology, so around 8 and 9 weeks, where the tongue is developing and the jaw is developing and the airway. And these structures form from one piece and they are supposed to separate and they need to fully separate so that the tongue has a lot of mobility and there's a floor of the mouth. Well, what happens with tongue tie is that process is changed in some way and it's inhibited. So it leaves pieces of tissue. Now, we used to think of tongue tie as a string under the tongue, but we know more than that since we've done some deeper anatomical studies that it's really about all of the layers of the mouth and the tongue and the jaw and how they work and fit together. So it's basically an embryologic malformation that results in having reduced tongue and jaw mobility. And that tongue and jaw mobility is reduced in the womb. So it's during the gestational playground or when the baby is practicing sucking and swallowing and breathing that these patterns are developed in the brain. And these, that's what babies use when it's time to come, for birth and get a good latch. And so it also depends on positioning in the womb and how much mobility. And that's going to be, for one reason or another, harder for some babies and easier. So there's babies that are going to have differently affected because some babies are more mildly affected by ties, where some are about moderately affected and some are significantly affected. And that's where I like to, differentiate between those three groups because that really helps guide us in whether a baby needs a release and if they do need a release, when it needs to be timed. So it's the tongue tie is this, limitation of tongue movement, which impacts function. So
Okay. And how
what,
common is it in babies? How often do you see this?
well, the published incidence is between, and there's a lot of different studies on this, between 4 and 11%. And most people settle somewhere around 8%. But that's still a lot of babies. Just numerically. If there's about 4 million babies born in the United States a year, and just even say 8% of them, that's a lot of babies. So that's why it seems like there's a lot of treatment going on, but that, it's a lot of babies. Now, not all ties need to be released. And the ones that do need to be released need to have this kind of functional assessment that guides us in our process.
So, have you seen with are there certain parents, like when you look at the parents, you can tell tongue tie is something I'm going to have to look at for this baby when this baby is born? Does that make sense? Are there any like predispositions that tell you that your baby is more or less likely to have a tongue tie? And then I guess that the follow up question, the next question would be, how can you tell if they have a tongue tie?
Well, before they're born, perhaps there's reduced fetal movement. Now, not overall where they've had to do a stress test, but they're in one position, like they're transverse, or they're always in one position. That's a big indicator because intrauterine movement is going to be, I call the tongue the epicenter of development. So everything's sort of organizing itself in the baby around the mouth and the tongue, very elaborate structure for function. And so when that is not moving, it affects the whole body. It's very rare that the tongue and the jaw are moving prolifically and the rest of the body isn't. So
Okay.
that would be one. And I would say, like, a baby is, not growing as well, maybe, or when the mom has more elevated fluid levels, a little bit
Oh,
of
interesting.
polyhydramnios. Yeah, because the fluid levels, especially at the end of pregnancy, are really modulated by the infant swallowing about 2/3 of the volume of amniotic fluid a day. And that just reduces it when we have, the genetic factors. Another one would be if the parents have tongue tie.
Mm.
because this is genetic. And so if they have obvious signs, or maybe they had a release, and a lot of people have, because in dentistry it's been done a lot for certain things here and there. It was like, oh wait, I got my lip released because of my braces, or this or that.
Mm.
So I think that, but I think the biggest clue is the positioning, which is why things like spinning babies and really having good exercise for your body during pregnancy. And also, I've been connecting recently with a really great dentist who is interested in the anthropological things with our skulls and how our jaws are changing shape. And he's even looking at how women breathe while they're pregnant. That could be setting babies up for more like gestational apnea type things. So I think it's really things like that. And always, if I think we have to have birth interventions, I'm always a little bit suspect, because we have such powerful reflexes from baby and mom to birth, that when we need interventions, there's something happening with, the powerful instinctual reflexes. There could be other things obviously ruled out, but a lot of times when I see babies with tongue tied, their reflexes are a little bit off. They're either exaggerated or inhibited.
How about for moms who are curious if their baby might have a tongue tie? Is this something like if nursing's going well, then you're probably fine? Is it something that every mom should have checked? Like what tells us it's time to have somebody look at it?
That's a great question. Nursing is the number one thing. That's going to be one of the number one signs. But just because they're gaining well and the nursing is going okay doesn't mean there aren't other signs. So I would say number one, trust your gut, because I think in a way we all know, or we wonder, and it's the questions we ask. And a lot of times we're asking them of our pediatricians and they're just dismissing them, which makes us kind of feel better, but it doesn't always solve that, like I'm still worried about it. But things like hearing noises while we're breathing, squeaking and snorting and whistling, and even sounding congested a lot. That's a really big um, subtle sign, I should say. There is such a thing as a big subtle sign. But also babies who aren't enjoying their movements in their body and developmental things like getting on their tummy and being on their side, and learning to hold their head up. It's just they have a little bit more challenge with all of that, and it seems like maybe their head turning preference is really strong, and it keeps that's very highly connected, as having the head turning preference. So I would say, working on those things and they're not getting better, then maybe you have time to have an assessment. Now, again, just because we have an assessment, and even if you find the appearance of a tongue tie, doesn't mean everything needs to be released. There are certain ties, like really to the tip of the tongue and really on the anterior part of the tongue. It's a lot more noticeable, but not all ties do need to be released. But we do always want to address the function. And so babies that need to be bounced and held a lot. Now, there's nothing wrong with that, because babies crave being held, and that's normal, but it seems like more than usual, you know?
If birth is getting closer and you're still feeling unsure about how to prepare, this is for you. My Essential Birth gives you a simple, step-by-step roadmap to prepare your mind, body, and birth partner for birth, so that you can stop wondering if you're doing enough and start feeling confident about the big day. And right now, you can still save $100 and receive all 3 amazing bonuses designed to help you feel even more prepared and empowered: the Birth Partner Quick Reference Guide, Belly Mapping Guide, and Empowered Birth Meditation Track. But this extension won't last forever. Join us by June 24th at myessentialbirth.com/get started and start preparing for a birth you'll love.
Yeah, that's interesting. Everything you're saying, even just, baby not wanting to be on their stomach or like extending their head, or all of that is making sense as you're saying it. So I'm like, oh yeah, I wouldn't have thought tongue tie. I would have thought tummy issue, colic, something like that. So I love that you're bringing that up, because that's definitely something to look into then. Yeah.
Well, and when we go to colic, that's a great connection, because colic is crying, and we usually associate that with GI issues. And the tongue is the beginning of the GI tract. So we call it the alimentary tract. So anything that the tongue is not doing is going to influence the rest of the what we call our enteric nervous system, or our nervous system inside of our intestines and our GI system. So the tongue is definitely impacting. So they're all going to be connected. And so I would consider, like, when I hear a baby has colic, I immediately think going to the midline and then to the tongue. That's,
Hmm.
right away.
Yeah. Okay. So who should be checking this for them?
That's a good question. And I think it's going to depend, because it does take additional training to get really good at this and to have an accurate assessment. But it's people like lactation consultants. But we all have to have training. It doesn't come with the lactation consultant degree. There's not a lot about tongue ties in that, but continued education, which we all have to do. So a lot of us have it. Occupational therapists like myself, speech therapists. Um, the pediatricians, many of them are beginning to learn more about it just because the parents have demanded that, which is really good because they're advocating for it. And I don't advocate to go straight to a release provider, the ones who do the release first, because not a lot of them have been educated about the need for pre-frenectomy therapy and for astute and practicing optimal timing of release. When they see a tie, they're like, let's release it. And so a lot of babies are getting released when they haven't been fully, really functionally assessed and determine whether it's good. So I wouldn't recommend going to them first, but going to the helpers, right, on the team, the feeding helpers and the body movement helpers. Because some of the things we see reliably is that, the head turning preference and even feeling like the baby's not moving a lot. Maybe they're even stiff in some areas, and they're fussy, or they do require a lot of intervention to stay happy, a lot of movement, a lot of bouncing and rocking, which isn't bad. It's just showing a need for something. It's sort of communication telling us there's something more to look for.
Yeah, it's interesting that you're saying that too, because another one was, babies that are fussy or have a head preference, right? We send them to the chiropractor, or that can be an option to send them to a chiropractor. But if a chiropractor isn't trained in the tongue tie stuff, it can look like it's helping. It probably is helping a little bit, but then you're not hitting that underlying issue. So, yeah, it's so interesting, like just all the things that are coming to my mind as you're saying this, and I'm like, oh, yeah, I wouldn't have thought to go tongue tie on that.
Right. And why would it get better, when we address it, even if we don't know about tongue tie? Let's say you even send them to a PT. If they don't know, a lot are learning now, but let's say they didn't know much about tongue tie. It's because we're helping the body move a little bit. And so the head turning preference is a compensation, and it's a stabilization. So it's a lack of movement. So when you introduce more movement, you're going to get an improvement. But like you said, may not be and are not addressing the root cause. Now, again, release isn't always the necessary element, but looking at the tongue itself and its range of motion and freedom is.
Yeah. Well, and you mentioned not going to the person that does the release too. Because we keep saying release, I do want you to explain what a release is really quick. But I remember being on, because I'm in the birth world and all this stuff, I'm on a lot of Facebook groups that talk about all kinds of things, and tongue tie certainly comes up. And I know that has been the concern for some moms. It's like you just take them to the dentist that does the release, and like they're just releasing everybody, which can cause other issues that, moms don't know about if you just go and have a release without having it assessed and maybe doing some other things first. So we talk about what a release is, and then kind of I guess I don't know. You kind of have gone over the science. I guess you can't really say like when they do or not, but you did talk about if it's like a little bit of an issue, a medium amount of an issue, or a more serious issue. Could you kind of like go through that as well?
Yeah. And that's true. And like I said, I think it's with a good intent that the release providers are just releasing, because it's just like that's what they have to give, and they see that and they know that will help. But it doesn't always, because of the way the body responds to these midline dysfunctions, all the compensatory strategies, etc. And also because of the size of the jaw and the way the tongue develops. It's not always easy, clear-cut tissue. And sometimes, the tissue is really buried and the tongue has a lot of, but a release itself is when we go to an MD or a dentist or a nurse practitioner who has a legal license to cut or release, do surgical procedure under the tongue. And they use scissors, a scalpel, and most preferably in the tongue tie world, a carbon dioxide laser, which is a non-contact laser. And it's where we lift up the tongue and the release is done in the white part of the tissue. So if you lift up your tongue and you see that white band, that's where we apply if you're using scissors, that's where you cut. If you're using scalpels, that's where you cut. And if you're using a laser, that's where you cut. So all three of those. And it cuts the white part, the connective tissue, the frenum itself, not the muscle, not the red stuff, not any vessels. It's just the connective tissue. Now, I'm not trying to minimize it by saying just, but I'm just limiting it to that. And so because it's too far forward on the tongue, it didn't, during development, it didn't separate properly. That whole process stopped. But the concept of, when we look at the jaw and how small that is as well, sometimes the tissues are buried and there's really not a lot. It looks like the whole tongue is like restricting it. And that's where we want to make sure we're not going in for a release, because it doesn't help at all. And we don't want to waste any time with babies, right? So I would say, one of the things is we do want parents to ask for people who have had training in ties, because it's a lot of assessment. You have to be able to understand, how the body is supposed to be looking and working and feeling in order to determine, like, is this a functional restriction or not? Is this going to impact? Because for me, like you were saying, you're mild, moderate, and significant. There's going to be babies who have mild symptomatology. Regardless of their class of their tie. Like, I just had a baby in here earlier. She's got a class 4, which is all the way to the tip, and she's nursing fine, and she's moving her tongue a lot better than a baby who even has more of a further back tie. But that's what I'm saying. You can't say exactly, because of the classification, what's going on. Now, because it's all the way to the tip, we are, looking for, as soon as we're seeing anything that has a functional impairment, we're going to address that, because that, the to the tip is never a good functional thing, because we need the tip of our tongue, even for oral hygiene, to be able to, clean our tongue and go around our mouth, etc. But I'm not sure I totally answered your question. Maybe ask a follow-up question. I get excited because, when we start talking about, babies, and moderately or significantly impacted, we just know that there's more symptomatology. So the baby between mildly impacted and significantly impacted is just symptomatology, because some babies have a lot of GI issues, a lot of reflux, gastric emptying, fussiness, distended abdomen, decreased bowel movements. There's all kinds of things that show up with this. And babies, that is so uncomfortable for them that they're also then crying. And that causes a lot of, we're trying to solve a lot of problems, and releasing the tie doesn't solve them, right? It's a part of it, though.
Okay. So when you have a baby that comes to you and they're having these issues and you release the tie, what do you see resolve, and how do you address the rest of it?
Through neuromuscular reeducation. So we're actually making sure the baby's in the right positions and getting the right postural challenges, exercises, and activities to elicit novel movement. And that's the exciting part. That's especially for a therapist or a lactation consultant, because that's working on the latch. That's getting into a better position. That's getting a better gait. That's getting the tongue over the alveolar border. Because all of a sudden, after the release, you all of a sudden do have a little bit more range of motion, and the tongue's over the alveolar border, and it feels comfy, and the baby's able to get a bigger stability under the nipple, and then better efficient expression of milk, or maybe, whatever it is. And this could be on any interface, but, that would be one of them, would be the greatest thing, to see that. And I think a lot of people notice that babies can turn their head a lot easier. And that, to me, just makes sense, because what that is when we release the midline pull, because that's what it is. It's either too tight or too short, right? This thing in the middle. So when you release something too tight and too short in the middle, it's going to have a nice impact on the head and neck. But because we're all creatures of habit, and that's including babies, sometimes we just habitually continue. But that's why we use therapy, to get a little bit different, movements into the body, and, give them because their brain needs to make neural codes and patterns and networks and neighborhoods of thoughts, where we can move areas of the body together, because before the tongue and the jaw usually never move separately. And now the tongue can really move and the jaw can move separately in a way. And that really makes a latch better. And it also helps babies be more settled because their mouth is closed when it's supposed to be. And that cuts down on reflux a lot. When you look at a baby that's got a lot of reflux, their mouth is usually open. I was just kind of like pulling it up and out. And we know we want.
Yeah, that makes a lot of sense.
Yeah.
Yeah.
And we have oral rest posture now. We want the tongue up and the lips sealed and the jaw gently closed. And that shuts it all off and actually sends it to the back where everything's supposed to be going down, down, down.
Yeah. Okay. Can I take you back to breastfeeding just for a second, Ben? So, aside from a mom who has pain, are there other signs or symptoms in regards to tongue tie just from breastfeeding? So, you mentioned something like a clicking sound that they can make. Does it have any effect on the transfer of milk or the making of enough milk? Can we talk about that?
Yeah. I don't know. I think it probably does affect milk, but what I do know is that every time you hear the click, that's suction breakage. So that's like like say you're hanging onto a bar and your hand slips. That's the suction breakage. You got to reestablish your grip to hang on. So that's losing your grip almost every time, and how exhausting that might feel and be. It's also because you have to reestablish your latch, usually a suboptimal latch. And you're always getting less volume with a clicking sound and the suction breakage just because you're not as efficient. And you're potentially swallowing a little bit more air than the average bear. So that's what's happening with that. Other one are asymmetrical latch. That's the obvious one. He does fine on the right and he has trouble on the left. Where one side's better than the other one, and even to a subtle degree. Again, mild, moderate, and significant problems. I think too, just popping off a lot and needing to reestablish. That's another one. Popping off the breast and need to reestablish, or, doing this movement where they're extending and pushing back and coming forward. That seems to be a subtle sign that I see with babies because they're having trouble moving their tongue. And so they're doing all this other fantastic body movement, which is nothing wrong with it itself, but it's not an optimal latch. And then I think, some babies that need to be asleep when they're nursing, and this is a subtle one because babies sleep a lot, but you notice that they eat better and they eat more when they're sleeping, or their pattern's better when they're sleeping, or they're really sleeping. One of mine nursed reverse cycled nurse, which is nursing at night. And so I think that does have an impact on your supply, especially if you're sensitive to that, because the baby's not efficiently expressing. And I'm a lactation consultant, but I work with great lactation consultants still in my community because you can't do it all, everything. But I always, with the babies I'm working with who have oral dysfunction and restrictions, I always say, in a sense, we always want to keep a really close eye on your supply with a baby that has a tongue tie, because it can, really be affected. And so I think another one is maybe you're noticing your supply is going down a little bit, and nothing else happened. And I think that's something that's a subtle sign too. Which is why it's really good to get connected with an excellent IBCLC who knows how to guide you to pump just enough or do something, whether it's hand expression or, manual pump, whatever. And then also making sure that the baby's nursing better. I think that's the big thing. We want to address it. So if you're working with a baby and they're not getting better and their latch is suboptimal, then we want to, really look at the impact of what's happening with the frenum, what's happening at the jaw, and, whether they, really need intervention or not. Because it's like, we want to not do a release if it's not necessary, but when it is, it's amazing. It really does make the difference in function, and difference in breathing, and difference in posture, and difference in just gut function overall.
Okay, you mentioned breathing. Actually, I'd love to talk about that for a moment. Kind of, how does the tongue function affect breathing or airway development in babies? What does that look like?
Actually, this is what's awesome, because the field of myofunctional therapy It is looking at the cheeks and the lips and the tongue and the jaw and how they function as a unit together. It's been around a really long time. Well, we're applying that to babies now, and we're looking at, deeper ways of how the tongue works and function. Because we know the tongue is a great feeder. We're using it a lot, and it's a great communicator. We've said that for ever and ever. I've been an OT for 30 years now. But now we know the tongue as a respiratory organ. So it's a part of our breathing system, and how it's positioned and what its tone and what its strength and how it postures itself in the mouth and how it responds and how it does its functional activities indicates how big our airway is and how well it grows. Now, babies we know are very small, and their faces are small and their airways are small. So the point of that is growing the head and the face and the airways over the first year, especially. And that's sort of driven by how the tongue functions. And we know that the, position of the tongue, if it's down, it's sort of everything's saggy baggy, but when it's up, everything's pulled up and pulled out and as opened as possible. So, that's one part of breathing, which is the airway patency, which is how big our airways are, how easy it is to get air in and out. Another one is breathing itself and how its air's coming in and out. And a lot of our babies, because of the position of the tongue and even sometimes their heightened level of arousal, they're breathing a little faster than ideal, which makes it hard to coordinate suck, swallow, breathe patterns, etc. So there's that part of it. And babies breathe faster than us at baseline anyway. So we need to look at the baby norms, which is 30 to 60 breaths per minute. But the tongue is either contributing to the airway being open and wide and breathing being easy, or it's weighing heavily and making it harder, which is why a lot of times we hear the squeaky noise, which we call stridor. And we hear it intermittent sometimes, we hear it, all the time sometimes. And there are other noises like the congestion or whistling or just feeling like you can hear the breath going in and out. So those are subtle signs. We always want to discuss this with our pediatrician. And a lot of times they'll alleviate our fears saying, well, this is in a normal range. Well, it kind of is, but isn't. We don't want it to just go on that way. We want to address it and optimize it. And we literally can. And sometimes it's, I developed tummy time method. And the reason why, and this was many, many, many years ago, because I became an occupational therapist, practicing in 1996. So this was right after back to sleep. And then I started having my babies. And so I knew that since we had moved from sleeping on our belly to sleeping on our back, that was going to change a lot of things neuromuscular wise. But it dovetailed so nicely into tongue tie because a lot of babies with tongue tie have trouble with tummy time and other types of, postural. So it's like a direct treatment doing tummy time therapy for tongue tie as well. And a lot of times we don't know that either. And so that's good to know that it's very powerful to work these normal neurodevelopmental positions for babies. And, we want to do it in a way that's regulating and fun, not too much and overstimulating. And it should also feed into better feeding, right? All of the activities that we're doing for our tongue and our lips and our cheeks and our jaw should also make our feeding better. And almost always when I'm working in my office and doing one-on-one hands-on, it's always the best latch that they get after we've been doing a little bit of work on tummy time. And it makes sense because if we think about how our tongue is in the middle and what has to happen in tummy time when we lift and turn our head and elongate these tissues that are so interrelated in their function and structure.
It's like yoga for the tongue for these little ones. Yeah.
Right. And it's also helpful to help our open up our breathing and strengthen all of the, breathing problems that big people have. We're looking at now is looking at exercising the tongue and the cheeks and the lips and the jaw to make that area stronger. It's actually showing up in the literature. Really important for sleep apnea of all sorts. So we know there's a big tie between our tongue.
Yeah. For these babies, say that we don't catch it. Say that maybe it's on the mild or moderate and for whatever reason, it didn't get caught. I would assume that these things end up showing up later. And so I'm wondering if that shows in the way of like speech development or breathing issues as they get older. And then at that point, who do you see? Who do you recommend that they see? Do you still head to an IBCLC? Do you look for an occupational therapist? Are you talking with your pediatrician? What are the signs and who do we go to?
Yeah. So the older we get, it can be stuff like teeth issues where they're crowded. The teeth are really crowded. And that would be to a dentist. There would be speech problems are definitely a percentage of the tongue tie world. It's not every single person that has a tongue tie has a speech problem, but there is a percentage of people who are affected. And so that would be a speech therapist. But we want to get a little bit more savvy with it, knowing about oral dysfunction restrictions, and make sure that it's a speech therapist that also has myofunctional therapy training. Because myofunctional therapy is it's a tool, it's a lens, it's a framework, it's a template of how we view part of the body system. And so it helps us with assessment and treatment approaches. Because just standard speech therapy or occupational therapy or physical therapy isn't going to have all of the information about the mouth to the degree that myofunctional therapy has, especially when we're starting to look at the tongue as a respiratory organ, as the jaw as a respiratory bone, etc. So that would be trouble, difficulty taking solids and eating solids. Say they become a picky eater, or there's only certain textures that they like, or you're noticing that they're not able to chew a certain texture, or they spit out a certain texture, or, they're not able to drink a certain way or through a straw, they still lose fluid out. A very messy eater, that would be more of a subtle, but it's one where you're just like, man, this kid is a mess, more than you would expect.
Yeah.
Just because it's hard to control and move. And, we use our tongue for a lot of the hygiene and saliva management. Persistent drooling, talking about saliva management, still drooling. And, you've been working on it for a while, or, you think, well, for sure now, I'm 100% saliva management from the very beginning. But not everybody knows that, and allows some babies to drool when they're teething. But, we should be able to swallow all the saliva that we make. Saliva doesn't belong on the skin at all. So in a sense, any saliva management at any age, but for sure, older kids. Another one that may be a little bit more subtle is emotional dysregulation. And this goes along with old GI issues. And there's a connection to our gut brain and how we feel, and like our emotions are in our gut. And so it's kind of all connected in that way. So emotional dysregulation, not being able to handle conflict, or not being able to handle interactions, or not, dealing well with challenges, or, that can be a really life-altering sign. And other ones, what's one that's really wild is a kid when their bed is a wreck when they wake up. You can tell they've been thrashing all night, and there's big puddles of drool. Because if we're not sleeping peacefully, we need to change positions intermittently throughout the sleep cycles, but it looks like they're, gone through it. That's another sign, because the tongue is not being the good breathing organ that it needs to be. And so the body, and also clenching and grinding, you can hear and see people doing that. And I would say kids who have sensitivities to things, like lots of things that develop maybe into allergies or that type of thing. It can really, honestly, it could be affecting anything, because it's affecting our autonomic nervous system, how our tongue functions, how we breathe, how we hold ourselves upright. And some people would even link, postural issues like scoliosis and humpback and lordosis, having to sway back, all that too. And I would agree, because, like I said, the tongue is the epicenter of development, and the body is fixing and moving itself and compensating around how our tongue is moving. That's true for us as adults as well, but it's especially true for babies.
Yeah, it's interesting. You're making me want to go look inside all of my children's mouths, and they're teenagers. Show me all your things.
Yeah.
Yeah.
And have them show off their tongue mobility. Mm-hmm.
Yeah, I'm not even kidding. Like when I'm done here, I'm gonna go make all my kids open their mouths. I want to see exactly what's going on in there. It's so interesting. Okay, so I don't want to keep you too long. This has been really, really wonderful. I do kind of want to end with this though. Like if there was something that you wish every new parent understood about their baby's oral development or about tongue ties or anything that we've talked about today, what is that thing? What would you like to say to parents today?
Only one. Well,
If
learn
there's
about
more,
oral.
you go for it.
No, just work on work on the feeding, make that as optimal as possible. But the real thing would be work on their oral rest posture. And this is the newer kind of information where we want the tongue up to the palate and the jaw gently closed and the lips sealed when they're sleeping 100%. And then when we're awake and not using our mouth, it kind of comes back to this, why we call it the oral resting position. It's the best gift you can give your baby because if we're thinking about things like crowded teeth and high arch palate and open mouth, that solves all those problems because the tongue goes up and it widens the palate and it shapes and grows the airway in a good way. And we grow our neuromuscular balance in our face. And so I would say that would be something. I've been really passionate about this topic for a long time and have actually been posting on social media since 2016 about this topic. And I'm really excited because there seems like there's a lot more energy behind it now, like, applying these principles to babies. And I always say it's one of the best, besides loving your baby as much as possible, it's one of the best gifts you can give them. And it's not one and done. It's like we're humans. And so you got to keep working on it and do it with repetition. It takes, and then babies grow. They grow really, really fast. And that's another thing is, oh, let me say one last thing is that seek the help you need at this time. Sometimes it feels like asking for help can be hard, but it's actually really empowering because there's so many of us out here that can give you help and support in these little bitty ways and change the trajectory for everything with just a little bit of support. And in a sense, it's like that's the old village we used to talk about, like leaning into the village. It's now a little bit experts in your area who know your baby, and work on them one-on-one. Get a little bit of support. And needing a little bit of therapy is not a bad thing. It's actually a good thing. It can actually really help optimize feeding and breathing and how babies feel in their bodies, which is really important. And also our connection with them, understanding them better.
Yeah. And I think doing it when they're young, what a benefit to like catch these things early, not only for yourself and the breastfeeding experience and all of that, but for your baby and their growth and development. So yeah, I think it's a wonderful thing that you've got working. So will you tell everybody before you dive off here, tell everybody where they can find you, your Instagram and all of that, which is a really lovely page, by the way. And I'll make sure to put everything in the show notes so everyone can find you.
Okay. Tongue tie babies on Instagram and tummy time method. Although I don't do a lot on social media, I just don't. I posted, and I just don't get on there a whole lot. But there's a lot of information because I've been posting for a long time. And I'm also my YouTube channel, Michelle Emanuel. I'm going to start doing more with that coming up soon. So that will be a good resource for people to come and tune in there. And my website's tummytimemethod.com. And you can email me or even text me if you have a question. Or I train people all over the place, therapists and lactation consultants. So I sometimes am connected in areas where, if you're looking for somebody to help you with your baby, I can help guide you.
Oh, wonderful. Yeah, that's great to know. Okay.
Mm-hmm.
Like I said, I'll include all that in show notes. And thank you so much for being here today.
Welcome. Thank you.
If you loved what you heard today, the very best way to support this podcast and help other moms to find it is to leave a quick review. I read one at the beginning of the episodes, and I would love for yours to be next. And if you're ready for even more pregnancy, birth, and postpartum goodness, come join me in the My Essential Birth course at myessentialbirth.com, where I will hold your hand and walk you through pregnancy and birth step by step so you're totally prepared for a birth you'll love. See you next week.